home for the last 2 years is the unceded Stalo territory, known to settlers as the Fraser Valley and Lower Fraser Canyon of British Columbia. And specifically, I'm in the town colonially known as Abbotsford. And funding for our research that we're going to present today was provided by the Michael Smith Health Research BC as the convening and collaborating program. Okay, so the learning objectives for today is to really identify three main categories of recommendations from the Provincial Roundtable and identify the top action items from each of these categories. And so the COVID pandemic really impacted every aspect of life and death, and the BC Centre for Palliative Care noticed that many of these restrictions that were coming in and the changes because of the pandemic really may impact how the bereaved were able to cope following the death of someone they cared about. So when beginning the research, there wasn't really much in this area, and so a lot of it was just really brand new for us also in the sense of what we were finding. Yeah. And so in May of 2021, the BC Centre for Palliative Care initiated the Grief and Bereavement Project with 6 members that were on the steering committee. So there was 4 people that represented the 4 leading organizations that provide bereavement support, and 2 public partners are also a part of the steering committee. And the goal of the project was to conduct research to understand the current state of bereavement in British Columbia and use this research to guide a province-wide roundtable, really with the experts and leaders in bereavement services that really aim to identify priority actions to address the needs of bereaved people and recommend different strategies to really improve bereavement support services throughout the province. So we set out to understand how people in BC have experienced grief during the pandemic, also how and where British Columbians access their support after a loss, how bereavement support has changed through the pandemic, what forms were effective, and also what could be done better. And so we completed 9 different research projects to really inform this roundtable. So we did 2 literature reviews, one on bereavement in the pandemic and also bereavement in the context of being unhoused or vulnerably housed. Then we also looked specifically at bereavement service providers, and so we've done a survey and interviews and also a symposium specifically for them. And then we also did research with the bereaved themselves, who had a death of someone significant since March 2020. And so we did surveys, interviews, and also a symposium again. Additionally, the last study that we did for this project was to survey frontline service providers who support people who are experiencing houselessness or vulnerable housing. And so as stated, we used all of this research to guide the province-wide roundtable discussion in BC that aimed to explore the strategies to improve bereavement experience for all British Columbians moving forward. And so this occurred last year over 2 afternoons in November. And so we had 35 participants, including 32 different organizations with basically 2 public partners that had lived experience. And the roundtable participants came from a wide variety of groups, including grief and bereavement support providers, researchers, community leaders, policy makers, and people who had experienced bereavement themselves. And this is one of the topics that most people have experienced that. So in the roundtable, they identified important actions that they really wanted to see implemented to enhance the grief and bereavement supports in British Columbia. And then the roundtable had a follow-up survey that was sent to the different participants to identify the most important action items in the next 3 years. So they've suggested it, and then they had a survey to then rank order them. And so a total of 29 people from the roundtable completed the survey, and that was an 83% response rate. So looking at the action plan, so it basically developed an overview of all the different ideas proposed by participants in the roundtable. And I will just state that we couldn't capture all the ideas. We just didn't have enough time. So there's going to be things that are probably missed that you're going to say, oh, hey, like this is something that would be beneficial. And that's great. You know, we'd love to hear more about that. So there's 27 action items that were grouped into 3 pillars or themes. So accessible, appropriate, and equitable grief and bereavement supports. And the action items under each are ranked in the order of basically the most important actions ranked by the group for the next 3 years. And so how we did that, just to give you an idea. So let's say there's a category that had maybe 5 different action items in it. The rankings of the priority actions were determined by using a weighted calculation. So for example, if let's say they had 5 action items, if you chose this one as basically the most important, what happens is that would be assigned 5 points, and then it would go down, and the last one would be assigned 1 point. And if there was a tie between two, I guess, numbers of total scores, how we did that was the one with the top rankings, so more number 1 rankings, would be ranked higher. Okay, now we begin. And so for Pillar 1, it's called the Accessible Grief and Bereavement Supports, and it has 2 sub-themes that focus on improving awareness and availability of grief and bereavement supports. So the vision here is British Columbians are aware of existing services, able to find the resources they need, and able to access the right supports for them at the right time and through the service delivery mechanism of their choice. So roundtable members propose the following 11 actions. So for the first one, so there's 5 action items under awareness of supports, with number 1 being ranked most important by the roundtable members. And so the first one, ranked highest, was develop a roadmap for bereaved people on what to do after a death. So as many of you know, after death, bereaved individuals really become responsible for organizing the death rituals, closing estates, disputing property, and just so much more. That's really taxing in a time that they are very distressed. So most individuals are really not aware of the steps that need to be taken and the forms that need to be filled out after death has occurred, and leaving them to really navigate this complex system while grieving, a lot of times alone. And so a roadmap tool would be actually really great to be developed that illustrates the steps that need to be taken. So ranked second was to establish a central navigation tool for bereaved people to better identify available resources. Number 3, engage in proactive outreach to connect bereaved people to the grief and bereavement supports they need before death occurs. Number 4, create a resource hub for grief and bereavement support providers to find information, tools, and other resources on evidence-informed grief and bereavement services. And lastly, number 5, establish reasonable regional navigators for grief and bereavement services that act as living resources for accessing supports in their communities. So the idea here is you'd call someone and they'd be able to guide you. So there's 6 action items under awareness of supports. And so here, for the rank number 1, there's enhance the availability of free and affordable, flexible grief and bereavement support options for the bereaved. So this includes, people spoke about having 24/7 access to a bereavement toll-free helpline, in-person supports, virtual supports, one-on-one, group, peer supports, and much more. There's a lot that goes into that. Also, ranked number two was advocate for funded grief and bereavement supports as a universal benefit under Medicare. And number 3, strengthen access to grief and bereavement support providers in long-term care homes and also in hospitals. Ranked 4th was advocate for enhanced bereavement leave benefit for employees. And number 5, promote the establishment of a provincial government ministry for the bereaved. Number 6, draft a Bill of Rights for bereaved people to outline their basic entitlements during the grieving period. So for pillar number 2, this looks at appropriate grief and bereavement supports with 2 different sub-themes that focus on improving grief and bereavement literacy across society and also enhancing education and training of service providers. So the vision here is that British Columbians are informed about the death, grief, and bereavement, and really how to cope with some of these difficult life experiences. So additionally, formal support providers, healthcare providers, and other frontline professionals are equipped with the knowledge and skills that will really enable them to deliver high-quality grief and bereavement supports based on the acceptable standards. And so the roundtable members proposed basically 9 different action items for this. So there are 5 action items under grief and bereavement literacy. So for the first one, ranked number 1, was enhance grief and bereavement literacy for all healthcare professionals. So education is really needed for healthcare professionals on how to support and communicate with bereaved people and their families. So training for healthcare professionals really should educate them about grief, what it is, bereavement, and also prolonged grief disorder. Also teach them to engage with individuals who are bereaved and inform professionals about how to connect their patients to available grief and bereavement supports in their communities. Ranked second was enhance grief and bereavement literacy for students, teachers, and counselors in schools. Ranked third was to develop and implement targeted promotional opportunities to introduce grief and bereavement literacy materials to the general public. Fourth is to develop resources and training materials to enhance grief and bereavement literacy in the workplace. And lastly, create a provincially coordinated marketing and communication strategy for grief and bereavement. So there are 4 action items under grief education and training. So ranked number 1 was to collaborate on the development of evidence-informed training opportunities for all support providers. So many organizations really have developed different grief and bereavement support training programs for their employees and volunteers based on their own experiences and their unique needs. But by really bringing together all the different hospices and community organizations and other grief and bereavement expertise and to really consolidate the various training resources available into like a single evidence-informed educational platform could be created. And that platform really could host several training programs based on criteria like the level of need or the level of role of that practitioner. So if it's a volunteer or a program facilitator or versus a counselor. And the training programs could also be made available to all community organizations and private grief and bereavement support providers throughout British Columbia. Ranked second was to establish standards for grief and bereavement support service delivery. Ranked third was to develop standardized competencies for volunteer grief and bereavement support providers. And fourth was to develop a grief and bereavement support ladder framework to outline the different levels of need and identify appropriate supports for each level. The last pillar, number 3, is equitable grief and bereavement supports. So the vision here is that all British Columbians receive supports that are tailored to their unique needs and experiences and respectful of their diverse cultures, beliefs, religions, traditions, and worldviews. And so the roundtable members proposed the following actions, following different 7 actions. And so first was to enhance available grief and bereavement supports for children. So children experience grief and bereavement differently and require supports that really meet their developmental needs. And number 2, offer culturally tailored and non-traditional grief and bereavement supports. Number 3, embrace culturally humility while supporting Indigenous peoples who are experiencing grief and bereavement. Ranked 4th was to enhance grief and bereavement supports for healthcare professionals and frontline workers after the death of a patient or client. And number 5, enhance grief and bereavement training for outreach workers who support individuals experiencing houselessness. Number 6 was to create safe spaces for bereaved people really experiencing houselessness to grieve. And ranked 7th was hire more Indigenous elders in grief and bereavement support organizations. And so I did a lot of reading there. There's 27 action items, so I know it's a lot to understand and really sort of feel, but there's a lot of stuff to do, and that's really sort of the point of this. There's a lot of work that we can be doing. So, and there's still a lot of work that still needs to be done to ensure that all British Columbians have equitable access to effective grief and bereavement supports. So further research studies are still expected to be necessary to really better understand certain aspects of what is needed to implement these different action items that were really suggested by these knowledge users, as well as research studies to assess the programs and the resources and policies that will be developed. So a working group, or groups, I should say, will next be needed to be able to be created to begin to implement some of these action items and even others. So personally, I have a lot of hope that the research that this produced will actually have a benefit to people in our community, and that the action plan will be a helpful resource to guide really the improvements of grief and bereavement supports within British Columbia. But the task of implementation is really too large for any one organization to be able to do alone. And I think everyone knows that. We have to work together as a community, as people. So it'll be by these organizations and people working together that we will be able to provide the much needed improvements to grief and bereavement supports in our communities and throughout the province, and hopefully be a landmark or a lighthouse for other provinces and other places to be able to improve their grief and bereavement supports. So the action plan, we were hoping that it was going to be available today, but it's not. And so the plan is that it should be available sometime next month. And so if you sign up for our newsletter, I don't know if, Tina, you can put that into the chat, then you'll get notified when it is released. So you can sort of see more exactly what went into all this and how we describe each of these categories in some more detail. But this is sort of just like a Coles Notes kind of version. And so with Echo, as sort of Tina sort of spoke about, it's a little different in other talks in the sense that you hear a little presentation, but then you go into groups and you really talk about an aspect of something, and you can have that time to sort of really discuss your own opinions. And so for this one, for the group discussion, what we'd like you to discuss is what potential actions can be taken to increase grief and bereavement literacy. So if you remember, the recommendations really covered enhancing grief and bereavement literacy throughout society. So in healthcare settings, like with healthcare professionals, in schools, with students, teachers, and counselors, also in the workplace. So creating resource and training manuals, but also general public with targeting promotional opportunities and communication strategies. So be creative when you talk within your groups on different things that you're going to sort of propose. And I think it's going to be really fun. And you each all have a lot of wisdom in this area. So yeah, be creative and really comment on other people's ideas to try to make it better, or to sort of see what else can work or improve that idea. And then what we'll do is we'll come back, and it won't be a force share, so there doesn't need to be a group leader, but you just come back and then I'll just put it out to the group, what was discussed and what kind of ideas that they thought would be beneficial to increasing grief and bereavement literacy. If you'd like to share some of your ideas or some of the ideas that I talked about within your group, I personally would love to hear them. I'm always learning, and I know a lot of other people would also, on basically what potential actions can be taken to help increase the grief and bereavement literacy, and so the knowledge around that within our communities. And so yeah, so if anyone wants to begin, you can either raise your Zoom hand, or you could also put it in the chat.
I'm raising my hand. Oh.
Hello?
I
Hi.
think,
Yeah, can I go for it, or does someone else?
I think there's Langley Hospice. Are you saying something also or no?
Well, we were trying to figure out how to put our hand up, but we'll see.
Okay.
So Anne Marie, go ahead and we'll come back after her.
Okay. So Anne Marie?
Oh, I was just gonna say I'm quite interested on how the pilot project with Vernon End of Life and their navigators go. I think that would be quite helpful as a start to help with the grief and bereavement. So it's kind of like a point person for families and people to turn to. Yeah, definitely needs to be more action on the ground support than just, I think I heard people say, just resources for someone to read or being inundated with a whole bunch of emails or pamphlets. So yeah.
I see. So like a point person that can guide them to the resources necessary, or the organizations.
Yeah, and also just more on the ground support, like more one-on-one supports. And I know that we don't have the people for that. So it's kind of a very interesting time.
It is, and I'm not curious which organization. I just misheard the organization's name, but volunteer is one of the main supports that a lot of organizations utilize. Is that something that you foresee would be helpful in
Yeah, I think definitely a volunteer group, but more so with like specialized care. Like
Okay.
it can't just be anyone. It has to be someone that is familiar with these concepts and maybe even the different stages of grief and how different people grieve, including our children and our youth. So
Mm,
it couldn't just, unf- yeah, I don't think it's looking for volunteers for companionship
okay.
or necessarily to like counseling support, but more so how to cope and actually maybe a joint effort with that counseling piece, but that to me seems a little bit more specialized than a volunteer.
Okay. Well, thank you for sharing. Appreciate it. And next we have was the Langley Hospice. You guys were going to say something?
So we came up with a little list because the question was how do we improve literacy? And it's kind of a random list, it's not in any specific order, but we talked about Maple Ridge Hospice volunteered the experience of having an open house at their hospice area for doctors and community workers
Hmm,
and sharing what's done at the Hospice Society. So that we thought that was an excellent suggestion. We really feel strongly about getting some kind of support into the long-term care facilities, providing opportunities for them, the employees in the long-term care facilities to learn, but not only that, but to support the families that are working and living with their family members in there. We talked about getting support, more support into the schools. And it became evident here that we were not all aware that we are doing that here in Langley. We have a program where our Langley school counselors in their Pro-D Day are actually getting support from Langley Hospice and having an opportunity to learn about grief and what supports we offer. We're not sure if that's extended to all the teachers, but we think it is. And we have also had a suggestion around getting just the basic information, like even if it's a provincial brochure, into hospitals, long-term care, doctors' lounges, all those places. And we don't see them, so we're not sure if maybe that is already done, but it may well be.
And also in multiple languages.
And multiple languages, that's something else we talked about.
The brochure.
And then Sharon, you mentioned Roots of Empathy, and I don't know what that is, so that was the last head on the list.
Well, Roots of Empathy is a program where dealing with young children and babies, so that they take babies into a classroom. And the class learn about the babies and they study them for a period of months. And it's very effective at having children relate to the baby and learn empathy through that. And it has become a huge program. It's international now even. And I was thinking if we could somehow have that kind of a model, whatever it dealt with bereavement, I think it's very effective. Roots of Empathy is just tremendous in schools. It is, for sure.
that's amazing. Those are really great suggestions, and yeah, you really had a lot to say on it. And you're right, there's a lot of work to do. But I thought it was really interesting. I said like even with your own organization not knowing exactly what is going on, it's just I think a showcase of like how are other people supposed to also know what's going on and where to send people. I think that's sort of one of the issues is like really understanding what are people actually doing and how can we best support each other so we're not duplicating the work. But that's great. Yeah. So thank you for sharing all those. Hey, we have a couple people up. Cynthia, I think your hand was up next.
Um, our group mostly talked about deaf cafes, which I never heard of before, so I'm gonna be looking farther into it, and also we heard more about the Grief Fest as well. But I didn't hear much on our Indigenous, but yeah, I think we need more treatment programs out there. We only have one or two that run in BC. We need to put out more. And then we also talked about how we need to get the message to our youth and into the school. So how can we do that? And I was thinking, you know, if we can run groups for adults, maybe we can run groups for the youth as well. And you know, and there are, I mean, there's camps and there's hikes and there's little groups that they can join. But can we make one specifically for grief, you know, with a bunch of people that are trained to work with them? Maybe do a camp, do a weekend thing, give out as much information as we can. Because today our youth are losing a lot of their friends to overdoses and whatnot, suicide. So what I'm interested to learn about is what can we do to help our youth? Because that's where it begins. We need to start with our youth. I know this is the 20th century. And one thing too is that we're taught here is to keep updated as much as you can on everything that's going on. Because every year something different is up. We went through the COVID and now we're going through this opioid crisis, you know, so what can we do like to help the families that have lost their loved ones to that? Like, is there a particular treatment program that they can go into rather than just taking an alcohol and drug program or a trauma program? Can we create programs for that? And I think it's needed because of all the losses through COVID and then, like I said, all these suicides and so I don't know, there's so much work to be done, especially within our Indigenous communities. Like how do we get that word out to those communities that are far away? You know, like what do we do? Like how do we get their attention? The ones that don't have the resources or don't have anything. You know, like what can we do to help them? I have a lot of questions. But
Yeah, a lot of questions, but you have your eye on like different people or organizations or spots where more grief literacy needs to be made aware. And as you sort of said, like the youth are really important to be able to focus and have programs for and specific resources and programs that that fit to them. So like adults are different than what youth love to do and what children love to do, and to have sort of those resources within their communities is just very important. And so, yeah, I think that's great. Thank you for sharing. All right, next we have Sandy.
We talked about a lot of things that are in the chat now, but we did talk about death cafes, the Good Grief Festival, the idea of normalizing death as we celebrate birth all the time. We kind of shy away from, we do celebrations of life, but we shy away from talking about death in a normal way, in normalized way. We find it a little bit of a taboo subject. And we thought that it's sort of a North American culture too, that there are many places in Europe and other countries that are more accepting and can work with death. We talked about it going into schools and through counselors because the opportunity is always there. If you have a pet in your classroom, whether it be a goldfish or a gerbil, and it dies, it's just a point right there to work on a small kind of grief with children, not their parents, grandparents, or siblings, but something like a pet. So you can work on that. And we can also get the information out there and try to get people in comfortable small groups where they can feel safe to talk about their grief and about their feelings about death. We do bereavement classes in Cranbrook, and they're small. And I just to quickly say that I went in one day when they were having, it's always closed into our boardroom, and it was very quiet, very hushed voices. I went in about, a month later, there was raucous laughter and carrying on from that same group. And I stuck my head in and asked if they had alcohol in there because they sounded like a party group. But they had become so comfortable with each other, they never wanted that group to end. And I do believe it carried on in coffee shops. And we had an overdose, a mother who'd lost her kid to overdose. We'd had someone lost a spouse. So it was a mixture, but they all grieved differently, but they all got together and bonded. It was something for me. I didn't hear it, I wasn't a part of it, but I got to hear how they had changed and how they had bonded. So I think those small groups are hugely valuable.
That's yeah, I believe so too. It's nice you got to sort of see that because you're right, something that's very uncomfortable until it's not. And sometimes you just need to be around people where it's not uncomfortable anymore and it just allows them to sort of share and sort of normalize exactly what they're going through. So that's amazing. And I think the last hand that we can take is Empty Cradle.
Um, oh, thank you. Or my mic? Okay. So thank you very much. We started in our group talking about how in our society, people don't know how to handle grief. It's not something that's openly talked about, but groups are starting to present presentations and workshops on various topics associated with grief, death, dying, end of life, whatever you may have. The Senior Center in New West put on a 4-day workshop last year discussing various aspects of grief, death, and dying, and it was well attended and very, very informative. So we need more of those. But the other idea I was going to bring up that I didn't get a chance to say in the group, so I'll share it here, is most groups are started when somebody has a need and that need doesn't seem to be met in the community. Empty Cradle started when one parent in Coquitlam 30 years ago had a stillbirth and couldn't share with anyone because no one she knew had ever endured a pregnancy loss. So she put an ad in the paper, rented a room in her local church, and Empty Cradle started with a very, very full room. It's still in existence because we fight hard to keep it available for people who need it. And we've got over 200 people on our mailing list that get a newsletter every month. And some of them will even attend support groups that we offer. So the best way to get information out is to start a group somewhere and have that group share. We have a website, we advertise on Facebook, we send out newsletters, we have groups, sessions, we have a lending library, but you have to start somewhere. And that somewhere is usually a person who needs something and can't find it in the community.
No, thank you for sharing. Yeah, I think it's important that a lot of these bereavement or these losses that people do have, which is prenatal, even pet loss, that tend to be disenfranchised within the community and they have to almost start their own. It's great to be able to like basically just raise awareness on that and the importance of talking about these griefs after the death because they are important and they can feel just as severe as all the other ones and it's all individual. And so I'm really happy that the group got started and it's really sort of opening the doors for more people to talk and feel and normalize their feelings when these events do happen to them. So thank you for sharing. I think we are out of time and we're just going to wrap up. Tina's going to say a little bit more about the next talks, but thank you everyone for being here. I must say I love this. I love the conversations that we're having. I would have loved to have been in all your groups to sort of hear more about what was said.
Great. Thank you, Joshua. Thank you everyone for participating. I have to say you were an extremely chatty group. We love that. Lots of hands up and lots of comments and suggestions and links in the chat. We'll include those in the summary notes so that you have that when that's sent out to all of you afterwards. As Joshua said, we are starting in August an actual series every month on grief and bereavement literacy. Our first in that series is, sorry about that, my screen just changed, Finding Hope and Resilience After a Substance Use Related Loss. That will be on the 15th of August from 12 noon till 1 o'clock. And every month following, we will have a session in that series. Joshua has planned out a year and more worth of content, working with some of our partners in community to share their stories and experience. We ask if you have some time to do a post-session survey for us. Jacqueline, if you have that link to pop into the chat, that would be great. We'll also follow up with an email with the link. The more we know about how much you are enjoying these sessions and what we can do to improve them and what other content and conversations you'd like to have, the more we can create for you in terms of this series and for other ECHO sessions. I'll also just finally add that check out our center webpage for information on other ECHOs that you might be interested in. And thank you to everyone for attending today. Have a great afternoon and hopefully see some of you next month.